Hello and welcome back to the Adrenal Fatigue Podcast. I'm Angela Racchio and I'm here with my co-host Danielle Aziz. And today we are honored to have Dr. Achina Stein here to chat with us about her and her son's incredible recovery journeys and her book, What If It's Not Depression? Her story is very relevant to our community and we know this conversation will be a contribution to many of you. So Dr. Achina Stein, again, is the author of What If It's Not Depression? Your Guide to Finding Answers and Solutions. She is a board-certified psychiatrist and has been in practice for 25 plus years. Propelled by her son's health crisis in 2010, she found functional medicine, which resolved all of his mental health problems as well as her own. She has a very busy private practice called Functional Mind LLC in Rhode Island, Riverside, Rhode Island, where she sees patients for functional medicine primarily, but also sees patients for psychotherapy. Dr. Stein is a certified practitioner of the Institute for Functional Medicine, a distinguished fellow of the American Psychiatric Association, and was awarded the Exemplary Psychiatric Award by NAMI Rhode Island in 2008. She is a former clinical assistant professor of psychiatry and human behavior of the Warren Alpert Medical School of Brown University. This is an exciting time for her. She has recently launched her online health program, What If It's Not Depression Boot Camp, as a companion program to her book to provide an alternative to medication for people with chronic, mild depression-like symptoms that do not respond to antidepressant medications. She enjoys playing ultimate frisbee, singing, and gardening. Dr. Achina, when we first heard your story, we knew we had to have you on our show. We have hundreds of people that come to us every week that have been told by their doctors that there's nothing wrong with them and that their blood work looks fine. And they're often left feeling like it's all in their head, and they're prescribed often and encouraged to take antidepressants as a solution. A lot of the time when people reach out to us, they know in their gut that this approach doesn't really feel right, like a right solution for them, and they're searching for the missing piece. So here inside the Adrenal Recovery Collective, we believe that there's way more to the story that's not being investigated. And it's leaving people miserable and scared often and feeling like there's no other option than synthetic drugs and antidepressants. You have so much wisdom on this topic, and we know this conversation is one that will inspire and offer a lot of our listeners hope. So welcome, and we're so grateful to have you here today.
Oh, thank you so much. I'm so happy to be here, and it's my pleasure.
Yay, it's an honor. It's an honor to have you. And so to start things off, Dr. Achina, you and your son's health journeys, they're both truly incredible. And I know your son's health crisis was really a turning point for you. And so we were wondering if you could start by maybe sharing a little bit about that story with our listeners today.
Sure. I know a lot of people tell me that it is a story that inspires them, and I think it is an incredible story, especially since it really made a huge difference in my life. It really opened my eyes to another way of thinking about things. I worked as a conventional doctor for over 20 years, and so my son, at the age of 14, he basically overnight had an acute depression with suicidal ideation, something that just kind of came out of the blue. And it was after just a minor argument or tiff, really, not even an argument. It was just a tiff with his brother. And suddenly he was standing on a ledge 5 floors up saying he wanted to kill himself. And so, of course, we got him into a safe place and, try to figure out like what's going on here. And, he said he was very depressed and just didn't want to go on with life. And I knew in my heart of hearts that wasn't the real issue. And I knew that something else was going on because there were other symptoms. He basically couldn't read. That also switched overnight. And I always say to this day, I don't know if that symptom wasn't there, if I would have thought that this was something more than the classic depression. Oh, now it's my turn, because both sides of the family have, depression, significant depression actually. And so I would have probably chalked it up like, this is my family history, this is going to be his destiny, blah 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 blah. And time marches on with putting him on antidepressants and things like that. So we did put him, have him see a psychiatrist, and he was basically put on 3 or 4 medications. He was having a lot of difficulty sleeping at night, so he was on an antidepressant, he was on an anti-anxiety medication, he was on sleep medication, and then he was also found to have ADD, so he was on a stimulant. And so, yeah, he was a much safer place, and he was stable, and he was also seeing a psychotherapist, and certainly better, but he was not my son. And the thing that kept me going in terms of finding solutions was really actually the symptom of, like, why can't he read? It happened exactly at the same time. And I took him from doctor to doctor to doctor, and nobody could really give me answers. And it was like, okay, we'll do this, and we'll do that, and we'll do this. It's like, but none of it was working. And it was extremely frustrating, to go down this road, and nobody was explaining anything to me. And here I am, a doctor, not only am I a doctor, I'm a psychiatrist, right? So I started to do my own research and trying to figure that out. And serendipitously, around the same time, parallel to all of this, I was finding that there were patients that weren't getting better. And I'm one of those people that really have always been, even before I did functional medicine, even as a conventional doctor, would spend a lot of time trying to figure out what was going on with the patient, why they weren't getting better, what was going on, what am I missing? There's something I'm missing, and I just don't know what I don't know. And I was searching for alternative methods of healing for my patients. So, 2 paths crossed at some point, and I found a functional medicine doctor who could help my son. And I found that doctor in the process of trying to find alternative ways of healing. So I took him to this doctor, and he basically found all sorts of issues. And here I was told my son was a healthy teenager, but in retrospect, he actually was not very healthy. And but we were told that he was healthy, and that some of the issues that he had all his life were just, well, that's just the way your son is. So he had chronic constipation all his life, and he had chronic eczema, severe eczema, all his life. And so those are signs of inflammation. And I kind of accepted that. Oh, well, I have eczema, so he has eczema, and so ultimately he was found to have celiac disease. And as a result of the celiac disease, he had severe amount, nutritional deficiencies, and a host of other issues, So it was a number of things that we basically, decided were the drivers of inflammation in his body. And we're able to pull out first gluten and dairy, because there's a lot of cross reactivity. And just by making that change alone actually made a huge difference. The eczema and the constipation went away in about a month. It took about a month for it to go away. And that's how he got the buy-in too, because he saw a major change, and he knew, like, wow, I've been dealing with this all my life and these are better. So it didn't necessarily fix the depression or the anxiety, but he continued to pull all the other drivers out that was presented, and to fix them one by one. And within a year, his mood significantly improved. It took I believe a year. I'm always off on the timeline, but about a year to 2 years to completely come off of all the medications. And yeah. And so what we found, ultimately, his eyes took 3 years to get better. He had double vision because he had inflammation of the cranial nerves of his eyes. And so the cranial nerves are very sensitive. Your brain is very sensitive. That's why it took so long for his brain to kind of snap back. And so it took a while for the depression and the anxiety to go away, and he came off of all the medications completely. But it was work. It was work on his part, it really was work. So, but it worked, totally worked. And he hasn't been on any medication since, and he's now 25 years old, I think.
That's amazing.
Wow. Yeah, what a story. I love that transformation.
Mm-hmm.
And what a journey.
Yes, it was a journey. It's a journey. It certainly is a journey. And I have to add, just so people understand, is that, when he went to college, he certainly fell back, into some of the old habits. You have friends, you want to party, the drinking, and staying up late at night and eating junk food. And sure, and then the stress of exams, he absolutely fell right off the tracks.
Yeah, that's difficult.
Yeah, but the beauty of it is that he knew exactly what he needed to do to get right back. So once he graduated from college, he went right back. He knew all the things that he needed to do, and he did. And so he's doing great again. So
yeah. Oh, that's good. The interesting thing that jumps out at me here is that so many people, like if you hadn't sought out a functional doctor to kind of dig into this, like it's so easy to just kind of stay like, oh, you're healthy and this is just the symptom and you kind of have to just deal with it. And I think that it's upsetting that you can feel so stuck there. But
absolutely.
It's also so inspiring at the same time. Like, this is why your story is so important, because for those people who are feeling kind of stuck there, like, I'm healthy by the book, but not feeling healthy, that there's this another avenue that you can walk down and explore so much. And just getting that information, so empowering. And like you said, for your son, life will happen. You go to university and all these other factors might come into play, but you realize then when you maybe start living in a certain way, what you need to do to kind of step back in line. And just that knowledge is so powerful because you know that you have some more control, right?
Absolutely. Absolutely. Yeah. And, I think now that functional medicine is becoming more and more, I don't know, I guess it's not mainstream. It depends on where you are, and who you're listening to, like so when you become familiar, it was so interesting the other day, the patient told me that she does her best job to tell all of her doctors that she sees, or any new doctors that she sees, about functional medicine. And it's like, so because she just wants to spread the good news, because she's 78 years old, and she's very vibrant and healthy, and had worked with me for a few years, and she still sees me like once every 3 or 4 months, to sort of maintain for maintenance, as she wants. And so it's still, I always find it interesting that there's still people out there that don't know about functional medicine. But I hope to someday that maybe 5 years from now or 10 years from now, that people will know that there's two kinds of doctors, and that they're both very valuable, and they both have their roles, and that conventional doctors, or traditional doctors as people know them, are really for acute care, and that functional medicine doctors are for chronic care, and that acute care is about fixing the problem acutely. It's almost like if there's a burst of a pipe, and water's gushing out, you need that emergency fix to seal the pipe. But then, you might have someone else come in later and try to figure out, well, why did the pipe burst in the first place, right? And it could be because, of the food that you're shoving down that pipe, and or it could be because of the type of water you have, or someone's putting, a chemical that's, do you know what I'm saying? It's trying to figure out, well, why did the pipe burst in the first place? And it could be just that it's 100-year-old house and it was time. Or it could be that there's something going on in the environment or through the pipes that's causing that to happen. And so, and usually there's multiple drivers that are in play that create that environment to cause that to happen, right? So those two types of doctors can really work in hand, and to bring somebody back to health. But there's two different goals. The goal of the conventional doctor is to keep that person safe and immediately fix the problem so it doesn't get worse, to prevent death or disability. And the other role of the doctor is to figure out why. And the goal is really optimal health and wellness, where you're thriving and not just surviving, you know.
Love that. And I love that you come from, you have the background of psychiatry and then you have moved to functional medicine. I think that your story, and it just makes it very valuable having both perspectives. Yeah, so thank you for sharing that, and I like how you made that distinction. So, and yeah, and on that vein, I kind of want to talk a little bit about your experience and your transition from that more mainstream psychiatric world to functional medicine. You talked a little bit about it, but I'd love for you to share a little bit more what that looked like for you, and what you're now doing, what you're doing now and how you meld the two. And
Mhm. Sure. I mean, so after my experience with my son, I basically asked the doctor, and his name is Edward Levitan. I always like to tell people who he is, because he
yeah,
basically is the reason why I went into functional medicine. And so it's sort of my way of thanking him and showing gratitude and letting other people know about him. Dr. Edward Levitan of Five Journeys, and he's in Wellesley, Massachusetts, or no, sorry, Newton, Massachusetts. So yeah, he and his wife have a practice there. And so I basically left my job as a medical director of a community mental health center, and I was there for 6 years, and said, I have to learn functional medicine, because once you know this information, you just can't turn back. I mean, to
yeah,
me, that would be negligence, really would be negligence. So I basically, worked for him, and it was in this gem of a practice where there were 18 other functional medicine doctors. And it was just a wonderful place to work and learn functional medicine. And I went through the whole process of becoming certified through the Institute for Functional Medicine, and went and worked there and learned how to be a functional medicine doctor. Um, Unfortunately, the practice had to close in 2015, so I started my own practice, Functional Mind LLC, in Rhode Island, and I've been doing that since. So the way I practice is I actually still do prescribe medications when they're necessary. I prescribe very little, but there are times, so I don't want anyone to ever think that I'm anti-medication. I'm absolutely not anti-medication. If you are in a car accident and you need a body cast, you're going to put that person in a body cast, and you're going to give that person crutches and go to rehab. I think medication can be used in the same way. You can use medication because the benefits outweigh the risks, and get someone out of a place of severe distress and dysfunction. And sometimes people are so distressed that they're psychotic and suicidal, chronically suicidal. So I think and I've seen people like this. I've seen people in severe distress, people who are actually refusing to take medication and needing to be court ordered because they are defecating on themselves and needing to be kept safe even from themselves. So I've seen the whole gamut. And so I think there is a place for medication, 100%. It's just a matter of how to manage that. So once a person is on medication and stable and safe and functioning, to the level that they can then be able to do the work of functional medicine, and then find out, well, why did this happen to me? Or why does this keep happening to me? Right. And so I think if you're able to get to that place, because functional medicine, it's work, it's an investment of time and energy. It's changing habits. It's basically being, Sherlock Holmes and Watson, trying to figure out, okay, where did things go wrong? And it's never one thing. It's not a silver bullet approach. It's usually multiple drivers. And so, I basically see a lot of people who understand functional medicine and are ready for that. And most of my practice is functional medicine. And I also have a handful of psychotherapy patients because I'm trained in doing psychotherapy as well. So having that background and training in looking at the root causes of trauma is helpful, but also understanding how trauma impacts all the other issues, the mind-body connection, is really helpful having that background. And so, as long as that person is stable, then I'm able to, work with them to bring the root causes of basically inflammation in their body. And then if they want, which a lot of times they do, to help them come slowly off of medications, depending on what they are. And sometimes I do say, you know what, because of this, this, and this, I really don't think it's a good idea to come off of these medications or this medication. And I explain why. And I think a lot of times when people understand why, they're more inclined to continue. And they might even agree, like, yeah, you're absolutely right, because of X, Y, and Z, when this happened and that happened. Or sometimes they're not willing to do certain things in order to make that transition off medications. They're like, you know what, it's just better for me to just take, 5 milligrams of X, Y, of that medication, because the benefits outweigh the risk. I'm not having any side effects. It's just easier for me, and that's a choice. And I think there's no shame in taking medication. I think it's a matter of having a back and forth conversation and collaborating together and being and feeling empowered to making those decisions.
I love that. I think that's
Yeah.
really important. And I love that way you shared that, because when people have more of a choice and feel like they have a choice and that there is another way, and there's someone sitting across from them telling them that there is other ways, and maybe making a suggestion and recommending based on your perspective and the fact that you have this bigger perspective than maybe some other psychiatrists, right? I think that's just beautiful. And it's, I'm just, yeah, your patients are very fortunate.
Very lucky.
Very cool. So I wanted to we know a little bit about your story too. And on that note, like you had your own struggle, right, with health crisis. And so would you mind sharing a little bit about that? I think that might be helpful for people too, since we're on that kind of that topic.
Sure. I mean, so, after I had my daughter in 1999, I had a couple years later, I had a Hashimoto's. I'm forgetting the timing again. I'm terrible with the timing on this, but I had a thyroid storm, basically Hashimoto's thyroiditis, and it was triggered by Epstein-Barr virus. And so I had mono, which I learned later that they're actually connected. Epstein-Barr virus can commonly cause an autoimmune thyroiditis, and which is what happened. And I was so sick that my primary care provider made me take a temporary disability, which was like, what? And I had just started a new job. So I was so like against that, but she made me, and I just couldn't function. I absolutely couldn't function. So we, got the thyroid stabilized, and, eventually I was able to function, but I needed a really pretty high dose of thyroid medication, about 200 micrograms. And basically I was just there. I went back to work, but I was pushing through everything. I had 3 little kids. And in fact, I just, you just do what you have to do, and you don't even realize how sick you are and what you're struggling with, because you have so many other responsibilities. And once I handled my son's issues, and I realized, maybe I can do some of these things for myself and make a change in my own health. And so, same dietary changes, gluten and dairy free, removing sugar. And, I always exercise, so that wasn't an issue. But I noticed a big difference. I had very, very severe allergies on top of, again, those were all my life. I had severe environmental allergies and severe eczema, and those kinds of things got significantly better. But when you have an autoimmune illness, it's really something that takes time. That's one of those things that take time to sort of bring those antibodies down. But you absolutely can reduce those antibodies by making changes in your diet and lifestyle. And so I eventually was able to bring my dose of thyroid medication down. And it wasn't even trying. I just realized that as I was feeling better, I was having symptoms of hyperthyroid symptoms because my dose was then too high, right? Because I was taking a dose of medication that I no longer needed it to be that high. So we kept bringing it down. And eventually we got it to 100 micrograms. And I've been there since then. And once you're on a medication like Synthroid, it's very, very hard to come off of it. And and it's never been my goal to completely come off of it. I just wanted to be on the lowest necessary dose. But I found that a lot of things got better using the functional medicine approach, not just my thyroid medication, but I was able to come off of all of the medications that I was taking for my allergies. I was taking Allegra, actually double dose of Allegra, Singulair. I was using 2 inhalers, the Provental, yeah, inhaler, and albuterol, I believe, and I was alternating. I had an Astelin nasal spray inhaler. So, and every so often I would flare and have to use steroids or creams, depending on whatever the flare was. So, and I was extremely sensitive to a lot of chemicals, and all of that got better. All of it got better. So I'm not taking, the only medication I'm taking is the Synthroid for my thyroid problem. And during that time, actually, my doctor, which I'm forgetting to mention, is I got depressed as a result of the thyroid issues. I was on this roller coaster. And so I was put on Wellbutrin at that time. And I have since been able to come off that medication. I only actually did that in the last year, so believe it or not.
Wow.
Yeah.
So incredible. And even just being able to reduce the Synthroid. I
Right.
mean, a lot of the times when it's autoimmune, and in cases that we've seen, it's just so easy for
Mhm.
people when they're not tapping into some of this more, functional work, or this more, addressing the foundations of health that functional medicine does. It's easy to kind of be upping your dose year after year.
Right.
And it's just so awesome and inspiring to see you lowering it to such an extent. I think that's so amazing.
Right. Yeah, I know it is. I mean, again, just like my son, you might have things that pop up for a variety of reasons because life still happens.
Yeah.
So stress is definitely one of those things that can cause, ups and downs in your health. But it's a matter of really learning that, noticing patterns, and paying attention, connecting the dots for yourself. And then when you recognize it in real time, then you know what to do. And so that's where the power over your health really comes in. It's paying attention, noticing patterns. And that's what I really help my patients to do, is to pay attention, noticing patterns, getting habits in place, like habits, and learning how to respond to situations rather than feeling like you're a victim to the situation,
Yeah. And one thing that you mentioned earlier too about, having that conversation, which I think we're talking about how it's just so important when you're deciding, like, what are you going to do? Are you going to take the medication? Is it appropriate for me? Like having that conversation back and forth and really kind of laying out the strategy and being able to see the strategy that is ahead of you. And by strategy, maybe it's the plan or the steps that you'll take. But again, it kind of comes back to knowing what those foundations are and kind of empowering yourself with that knowledge so that if things do get a little hairy when they will with life as we kind of go about our day or,
Right.
you know, go about our way, it's just nice to be able to be like, okay, well, this is the plan and I'm just going to come back to it and kind of get back on the wagon more full-heartedly.
Absolutely. So yeah, when I work with people, every time I see them, we give them a plan, and every time I see them, I ask, them to pay attention to how each intervention made them feel. Okay, so sometimes like they don't feel any different. Sometimes they see a slow improvement. Sometimes like, wow, when I started those digestive enzymes, I really felt a difference. So then that gives us information about, okay, that's like one of the top priorities, paying attention to digestion, and so when you have a return of symptoms for whatever reason, because habits drop off, things happen. It's like you have to prioritize certain things, or you can also even make a conscious decision about saying, okay, I'm not going to do this, meaning like I'm going to go on vacation and I'm going to eat whatever I'm going to eat and I'm going to take whatever happens. But rather than feeling bad about it or feeling like you're doing a bad thing, you could use it as an opportunity to experiment. It's like, okay, I'm going to see how that makes me feel to have, you know, gluten and dairy for a week. Let's gather information. And if you approach it with your eyes open, then you're absolutely going to gain information, and then you can compare notes, and it's like, wow, I have acne all over my face again. Gee, now I know that the acne is directly related to either gluten and dairy or whatever it is. It's paying attention, taking notes, and so you're making conscious decisions about your health. And I had a patient who always wanted to have a Viennese dessert table, at her wedding. And she knew that gluten absolutely causes severe migraines and it puts her out for 3 days. But for her, it was well worth it because that was part of her dream of getting married. And so she did it. And sure enough, she had a migraine for 3 days. But, she learned it, but it went from, with working with me, it went from having migraines literally every week, 2 times a week, not knowing why she was having it, to no migraines at all, and then
It's
making
huge.
you know what I'm saying? So then you have a choice if you want to do certain things, and you're going in like I said, eyes wide open and knowing what the consequences are going to be. That's your right, that's your choice, right? As long as you're not hurting anybody else, right? Then you have every right to act in that way. So yeah, and I think a lot of people don't realize is that, just so you know, that antidepressants are like the top shelf of ways of treating issues. There are lower volume or lower modulating ways of effecting the same change. If you do have to give some type of supplement to sort of stabilize someone before they can do the root cause work. There are absolutely herbs or different herbs or combinations of vitamins and certain nutrients to be able to stabilize a person's mood or anxiety or even attention, if it's on a milder level. So you don't have to go to the heavy guns as I talk about them, to affect the same change. Sometimes you do, and so it's a matter of experimenting and having that conversation of all the options. I think if you have a conversation about all of the possible options, then you're sort of giving the whole menu to decide. And unfortunately, a lot of traditional doctors aren't trained in that. They're not trained in all of the options, in terms of taking pills, but they're also not necessarily trained in all of the options that are non-pharmacological, and understanding the research that supports them.
Yeah. I think that's a really good segue to the next question we wanted to ask you, where if someone's doctor is telling them and they find themselves in this situation, to start with that top shelf solution. and they're not feeling like in their gut that that's the right move at this point.
Mhm.
Is there any place that you go, like general tips that you would offer when it comes, yeah, I mean, you mentioned the herbs, but when it comes to kind of just like starting exploring another faucet,
Mhm.
where would one begin?
Well, I mean, naturopaths are trained in there's all sorts, there's naturopaths everywhere. So you can go to the naturopathic field, you can go to homeopathy. There are homeopaths that have their approach. Um, but I think it's a matter of finding a functional medicine practitioner, if which are I think there's more naturopaths than functional medicine doctors, and there's certainly an overlap of the two groups because there are naturopaths that also become trained in functional medicine. I think it's a matter of finding someone who has that education. But in terms of online sources, I I can't say that there's one place off the top of my head. But there are people like Dr. Mark Hyman, who talks about all of these different ways of treating all sorts of conditions, not just mental health conditions. But people can read my book, and they're welcome to do that. I mean, that's like right there.
Yeah.
Uh, but I think, yeah, there's not a one place. I think there's multiple sources depending on and depending on what the issue is that they're trying to resolve.
Yeah, it's maybe just taking assurance that there are options that you could explore and then just finding some sort of functional practitioner. I mean, you work with patients, we could check out your book. What if
Mhm.
it's not depression, which we're going to ask you about in just a sec. But
Sure.
even like the types of like our group, right, Angela? Like this is the type of work we do in the Adrenal Recovery Collective, is just helping people. We've got a team of really great doctors and just helping people kind of take that first step into figuring out what what is going on, and then kind of evaluate and create a strategy from there. And we were talking about the importance of just having the peace of mind of having a good strategy, and plan ahead so you can know that each move that you're kind of making, you understand the sense behind it, which I
Absolutely.
think makes things a little bit easier.
Right. Right.
Yeah, thank you
Absolutely.
for sharing.
Oh, no problem. Yeah, it is hard for people to find someone that is trained, because you'll find people that are trained in a variety of different things, and it's hard to know upfront what that is. And I think it's just a matter of having a conversation about what they're trained in, how they can help you, and go on from there. But I think it's important for people to know that there are lots of options, a lot
Yeah.
of options. One of the things that I've been doing, I started a podcast that's a companion to my book. What if it's not depression podcast? And I'm hoping to get on to Clubhouse and start something by the same name as well, just for that reason, to interview people who are providing alternative treatments, but also enlightening people about root causes of depression. That Lyme's disease can cause depression, mold toxicity can cause depression, and a lot of people don't even think about that. And
Yeah.
so I think it's really important to get that information out there as much as possible. And so people can
So
start
important.
seeing it soon. I'll be on YouTube soon. I have 12
Awesome.
episodes recorded, so we'll
Oh,
be
yay.
sharing them soon. Yeah.
Great. So what
Okay,
do you
we'll
think?
be sure to link everything in the notes.
Mhm.
Sorry, Angela.
No, that's okay. Yeah. So, is there anything else you want to tell us about your book? I mean, I'm really glad that you shared that a little bit about it. Is there anything else that you want to share about how that can really support and help people? How you lay it
Sure.
out, or
Yeah, so it's on Amazon. You can download it from Amazon. You can also download it for free. It's going to be for free for a short time longer, from my website, which I'm sure you'll share in the show notes. But you can get it as a PDF from my website. But you can get it on Amazon as a print version, audio version, or ebook. the Kindle version. And basically I wrote the book for the person that you described in the introduction, feeling, blah, pushing through, languishing. The New York Times article recently talked about the word languishing as a way to describe what people are feeling in the pandemic. And it's just like, that's the person that this book was written for. And because they go from doctor to doctor to doctor, they don't feel right. They're told that they're normal, and it's all in their head, basically. And, and so my original title was, it's not in your head. There were actually 2 other books by the same title. So, but I think this title is even better. What if it's not depression? Because it's not truly a clinical depression. That word is used. I hate the word depression because it's used to describe so many things, and it's used inappropriately many times. And people are given that diagnosis just to justify, and it's not even a diagnosis, it's a symptom, to justify providing an antidepressant in many cases. And, it takes a long time to determine whether or not somebody has a true clinical depression. And it really requires a back and forth conversation like that to determine if taking an antidepressant is an appropriate option or for that situation. So my book basically outlines all of the layers how I approach, the situation in my office. So I've had patients that have said, I've read your book and it's exactly how you approach it in the office. So it's like being a fly on the wall, and it's everything that I do in my practice. But it's something, a lot of these things you can do on your own, believe it or not. And the parts that you can't do on your own is looking for chronic infections. You might have an idea of what those infections are. And so basically I look for, and the acronym is SHIFT. I don't do it in this order, but I look for stress, hormones, infections, foods, and toxins. So it spells the word SHIFT. But the order that I do it in is we look at foods first, because that's the fastest way that you can affect a change is by changing what you're eating, by removing all the foods that are causing inflammation and replacing them with foods that heal, and supply food to your microbiome. And then we do testing to look at all of the possible chronic infections that you might have, not acute infections, but chronic infections. And I describe infections as sort of your immune system coming to a truce with it and allowing it to live there, and basically looking at it as a burden that they have to deal with. And so if you unburden your body of these infections, and those infections could be H. pylori, it could be imbalance of your microbiome of good bacteria, bad bacteria. It could be candida, which is a yeast in your body. And there's a lot of conventional doctors that don't recognize that. There is small intestinal bacterial overgrowth, another thing that a lot of conventional doctors don't recognize, which is also known as SIBO. Parasites, worms. I can't tell you how many people have parasites and worms. That is not a third world disease or illness. So foods, infections, stress, depending on how much stress that they have. And I have parts of the intake that really look at how stress can affect a person, especially if it starts in childhood, and how that can ramp up and affect other times in stress. And then toxins. And so there's environmental toxins, there's emotional toxins, there's mold toxins. I mentioned mold. So there's all sorts of toxins that can, barrage your immune system. So I look at all of those layers, and so my book outlines all of those things, and you can follow along and try to figure it out for yourself. What are all the drivers? And once you know what all the drivers are, it's basically having a plan to address each of those drivers. That's what's most important. And so the part that, like I said, the part that it's tough to do is the testing. But if you do all the lifestyle changes, you don't really need to do the testing. If you do all the lifestyle changes and change the microbiome and heal the gut lining with foods that heal, you absolutely can make a shift in the microbiome set that so that you don't so that you can almost push out these infections that have been, colonized in your body just by changing those things. So a lot can be done without testing.
So amazing.
Mhm.
So everybody out there listening who resonates with these types of symptoms, you got to get your paws on Dr. Achina's book, What If It's Not Depression? And just to kind of build on, or to just dig into that a little bit more, you mentioned like an onion, right? You're kind of digging through these layers to find the thing or these drivers that can be kind of triggering all of these symptoms. I think we've heard you mention before, Dr. Achina, that childhood stress can really lead to more chronic diseases in adulthood.
Mhm.
And so I'm just curious, when you're doing this digging, do you often find that the causative factor is it more emotional stress than anything? Like, just for our listeners who that might be kind of a new concept for them, like
Mhm.
how big of a role can these emotional traumas really have on these symptoms that we might be experiencing today?
So in order to determine if it is a role for you, it's everybody's different. So
Yeah.
for people, it's not, it's a smaller role. For other people, it's a bigger role. So childhood trauma, absolutely, it's a bigger role, So I use a form called the Adverse Childhood Events Score. You could easily Google that and see what your score is. But childhood trauma, absolutely, it basically you're growing up in fight flight, and so you have adrenaline shooting up constantly day after day after day, and it's sort of almost like being on steroids all day, and if you've ever been on steroids, that can absolutely cause um, you to have mood shifts and hormonal shifts, and so having that chronic stress um, can absolutely cause you to have chronic disease. And so if you have an A score of 4 or more, that can increase your risk of heart disease over 60%. And there's a lot of research that has been done that shows this. And so the A score is in my book. It's also part of my intake in my private practice. And that helps to inform whether or not stress reduction really should be on the front burner and not the back burner. A lot of times when people learn about, oh yeah, I got to do meditation, and they just don't fit it in. They might do it once in a while, and I explain how it's extremely important to do it. Like, this has got to be top priority because of your A score, because of these traumas, and you can actually affect a big change by doing stress reduction techniques of a breath work or meditation. But we're talking about like 30 to 60 minutes of meditation a day and breath work, doing that, really focusing on it, because it really increases your awareness of all your triggers, how things impact you. There's so much that you get out of, and just putting doing things to help you be more in parasympathetic mode and know what it feels like to be in parasympathetic mode. I can't tell you how many people operate at this high level. They're in overdrive all the time. They don't even realize that they're in overdrive until they come down. It's like, wow, how did I even operate that way? How
Oh,
did I
girl, we've been
function?
there.
Right? Like, you don't
Yeah,
even
we've been there.
realize until you're not there anymore. It's like, whoa, I can't believe I did it. So,
Yeah.
and so there's so many things that, there's so many different ways of being under stress that's amazing. I talk about people having sort of these dust devils, that are triggering, like these thoughts that go around and around and around, almost like a tornado, 100 miles an hour. So psychotherapy can definitely help with that, and make it 60 miles an hour instead of 100. But ultimately, you do need to get at the emotions underneath that drives those kinds of issues, those kinds of thoughts. So um, I feel like I've gotten off topic. I forgot the question. So I'm going from one thing to the next.
No, that was so good. I think that's going to be so helpful for our listeners. And that's totally what we were asking.
Yeah.
I'm curious on the other side of that though. So of course, like you mentioned, everybody's different and it's kind of going to be different for everybody. But just based on what you see in like your day-to-day practice, do you
Mhm.
notice that it's almost like a mix of, for most people, is it a mix of a little bit from column A when we're looking at emotional stress, and then perhaps a mix of environmental, like maybe it's inflammation or nutritional deficiencies or allergies, something like that? Or do you find that it tends to go more one way than the other at all?
I have to say that because I'm a psychiatrist, there's lots of functional medicine doctors. Some people come from, a conventional world of primary care, or I know people who are ER doctors, some are gynecologists, So being a psychiatrist, obviously more people are going to come to me that have more of the mental health issues. So in my population, there's a lot of trauma and stress. And so, but that doesn't mean to say that I don't see people who understand functional medicine. And I had a guy who has no mental health issues at all, never had a mental health issue. He's got GERD, but he has stress from his work. So, but I definitely have a varied population. And I say absolutely everybody has a little bit of everything. It's just that for some people it's bigger on one. So if you put a column of 5 areas, stress, hormones, infections, foods, and toxins, it is variable. But it's always all 5, always all
Yeah,
5.
that makes sense.
Definitely does. And thank you for sharing that. Cool. So we want to know a little bit more about where we can find you. I know there's a lot of people out there that are going to be curious and what all you shared today and your experience. And so, yeah, where can we find you and learn more about you?
Well, you can find me. My website is www.achinasteindo.com. And I am, right now, I have a private practice in Rhode Island called Functional Mind. So you can easily Google Functional Mind LLC or my name, and you'll find me through that. I also have another program called What If It's Not Depression Boot Camp. And
Yes.
so for people who want to work with me out of state and can't come to my practice, they are welcome to consider working with me through the boot camp. And you can actually look me up for the boot camp at www.whatifitsnotdepression boot camp. No, what if it's not depression? Sorry. www.whatifitsnotdepression.com/boot camp, and learn about the boot camp some more. I'm actually going to be, I don't know when this is airing, but I'm going to be recruiting members for my next boot camp starting at the end of July of 2021. And that boot camp basically goes through all the different layers that I've talked about that basically follows my book. And so if people wanted to have more guidance and didn't feel comfortable going through it, or the discipline, sometimes it's discipline, it might be helpful to do it with a group of people and cheerlead each other on, and it's a 12-week boot camp. And it's basically to find the root causes of your depression, and it could be your anxiety too. It doesn't have to be just depression. My book could have easily been called What If It's Not Anxiety, So it's going through the root causes and finding your causes and doing all the things together to reduce your symptoms of depression, and having at least a plan for the rest of the drivers, because you're not going to be able to do it all in 12 days.
So great. It sounds like a wonderful program, and I love your book, and I started reading it. I'm excited to keep reading it. And I just want to thank you so much for sharing your story, your personal story, your story of your son. It's just a really valuable story, I feel like, and it's going to support people and inspire them to, I think, to get the help they need, and to look deeper and to dig deeper, find your drivers. So thank you so much for being with us today.
Thank you. Thank you for having me. I love talking to everyone about what I do, and because my mission is to really, dispel the stigma that if you have depression, that it's, lifelong, and that the only way to treat it is to take medication for the rest of your life and be in psychotherapy. And, I'm hoping that people have a sense of hope, and that there are other things that they can do and not have to be relying on these options for the rest of their life.
That is such an important mission. Thank you for being that person in the world. Yeah.
And I think for anyone out there listening, Dr. Achina, you've shared so many great resources that you have available to support people, and so much great wisdom in just this chat today. So we're so grateful, and we appreciate you being here so much.
Thank you. Thank you for having me.